Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care, hosted by Dr. Char.
Well, hello. How are you today?
I am doing great. How are you?
I'm wonderful. I'm so glad to have you on this podcast. Today we have Dr. Wendy Ingram, and she's a CEO of a Dragonfly mental health facility or company, and that's in Oakland, California. And I bet you can't already tell I'm from across the country from you. But I'm so glad to have you here today. And I just want to welcome you to my friends and my family.
Thank you so much. It's a pleasure to be here.
What got you started? I'm a type 1 with diabetes for almost 50 years, 3 times your age on this earth. And I am in mental health up to my eyeballs for 30 plus years. And so I know my backstory, but I would like to have a little bit of knowledge of what made you interested in helping in mental health and with diabetes. Do you have any family members or diabetes in your life, or what's going on with you that makes you help?
So one of my best friends growing up, we've been friends since preschool, honestly, got diagnosed with diabetes type 1 when we were in high school together. And so I know personally through my very, very good friend, her experiences, her struggles, and my interest in mental health is also through both family and friends experiencing mental health issues and struggles. I became very interested in psychiatric and psychological diseases when I was pretty young, again, kind of in that high school time, realizing that both these physical illnesses like diabetes, and especially type 1 diabetes, not the person's fault, and yet can impact their lives in really, really detrimental and powerful ways. And having a chronic illness that you're going to have to deal with for the rest of your life is very taxing on the mind and the emotions. And I've been interested in focusing on mental health myself because of friends who we've lost to suicide and depression. And so that's where Dragonfly Mental Health and my movement in that, as well as my research career, has all focused on mental health and trying to understand the biology of these diseases, and improve people's general knowledge about them so that we can reduce stigma and misunderstanding.
Oh, that is wonderful. I've lived long enough to know the days when it was a stigma just to mention that you had an issue. And now to live in a time when, now I don't know, when you were in high school and experiencing this, but my curiosity's up now of when someone had diabetes and they were struggling with that and you encountered that struggle, it actually brings some trauma on you. It brings that emotional discord even in your life, or distress if you're not mindful of it. And a lot of times we're not at a young age, or when it's a surprise. But we used to separate that distress from someone, let's say, with issues of suicidal or self-harm ideations. We used to say, yes, that is mental illness, or it affects our mental health. But we didn't dare say that diabetes could do that to our moods. And then we also we saw such a gap between it. We saw real severe cases as being, we'd let that be labeled, but we wouldn't if it was something that we could handle in our daily walk. When you were a teenager, did you see them still as separate, with your friend that was diabetes patient and your friend that was self-harm indicators there? Did you see them as separate, or by then was that all converged till you could see it in both directions?
Well, I think it's such There's so many layers to that question.
Yes, there are.
But
Sorry.
let's see what we can dig into first. I have, and I'm blessed or cursed to have a very visceral memory of my emotional experiences, even going back as far as high school. So I can speak from what it felt like at that time. And I think that in talking to students who are high school students now, they just see the world differently than we do as adults. I've had now 30 plus years of societal imprinting, whereas as a teenager, it was, my experience was a little different. And maybe, we didn't have social media and my parents didn't have a TV or newspaper. So maybe I was particularly sheltered from like societal views and what's separate from this and stigma essentially that we absorb from society. I didn't feel that. So my friends who developed type 1 diabetes and my friends who were struggling with mental health conditions, I just saw them as my friends, as people that were having struggles. And it was, just to bring back to one of the things you said right at the beginning of, it doesn't just impact the person experiencing those things, it impacts people around them for sure. And, my friend who one of the first days that the day she got diagnosed with type 1 diabetes was one where she got taken in a stretcher away from the high school because her blood sugar was so out of control and she didn't know.
And you didn't forget it.
No. Oh, I remember that day like it was yesterday. It was terrifying to have my friend so sick, so ill that they had to go to the hospital. We didn't know what was going on, that time of uncertainty. Once she got diagnosed with type 1 diabetes, it's like, there's this condition she's going to have forever. What does that mean? How do I support her? How does she deal with that? And then also, we're social creatures. And when we care about people, they're going through their process. And one of the things that, I'll reflect, and I've said all of this to her, we're very open. I will not use her name, but she would not be surprised to hear this. This wasn't necessarily shared in confidence, is that when she made choices to not take care of herself and her illness and acknowledge it, there was kind of this period of time every now and again where she would kind of rebel against this diagnosis, against this thing she now had, or knew she had it regardless, and would make hard, like tough decisions that as a bystander, as a friend, I can't force her to eat whatever she's supposed to eat, or not eat certain things, or not drink certain things. Like it's very hard as a family member or friend to be that bystander and be supportive of a person's own personal experience while seeing them harm themselves. And why she was doing that sometimes, like she was a kid, we were all kids. We all did stupid stuff. I definitely did too. But it is hard to see people working through their process and know that what they're doing is causing them harm.
Well, let me stop right there. I think that this is such a real important thing. I know we're not doing therapy right now, but still, I think it's important that we mention this.
Sure.
You are a teenager, and of course we're discussing how the diabetes distress is the same as some other mental health issues, or the severity of it, good, bad, or connected. But when you are the teenager in that setting with a friend, and you feel all the emotions of, you might not label it as this as a teenager, but am I enabling? Or am I judging? You have no control over that situation at all. Nobody has taught you yet, or maybe they did teach you ways of judging, or some may have taught you ways of enabling, but I'm sure you had to find your path of finding the peace and rest with loving her, letting her make her own choices, not pushing her, and yet not enabling her. I just had to stop in a minute for that. You think of all the many things that we have worked on through the years for patients, but what about the caregivers?
Yeah.
What about those that are walking the journey with them? We have so many people that I just fuss and fuss because my Dexcom goes off, and if the noise is heard across the house, my husband or my son, one will say, check your blood sugar. And I'm like, come in here and I'll pop one of you in the head. I'll just pop one more time. You say that one more. I have a video off on my Instagram that says, if they ask me one more time, what is my blood sugar? So I can see from both sides of this, but I think it's imperative that I stop there a minute and just recognize it's not just the patient.
Mm-hmm.
This is huge,
mm-hmm.
but it's not defeating us. No. When I was young and I had to pee on a stick, I didn't have a monitor, and it was bleak, bleak, bleak. The history was bleak. I mean, the future was bleak. And almost 50 years later, we have such hope. People live good, healthy, long lives. We stay mentally sound, mm-hmm. and we stay healthy and good feet. Mm-hmm. And it's all wonderful. And information is just rampant. All of it's not good, but there's enough out there till you can pick and choose.
Yeah.
But I just had to stop you for a minute and say, that little girl that had to learn that, I just wonder how much that impacted you to take you to your journey where you are today.
Yeah. Yeah, absolutely. And we're still close to this day. And so we've been on this journey together, and I've been supporting her this whole time, and she's been supporting me through all of my issues as well. And so I did mention people who struggled with mental health, and I mentioned my family, but myself as well. My first depressive episode was during high school. And it was something I experienced, and I didn't know what it was. I didn't have a definition for it. I didn't have the knowledge to ask the right questions about understanding that. And I definitely didn't have the words or the ability to educate my friends and my family who are trying to support me. And so there's a lot of confusion. There's a lot of misunderstanding. There's a lot of internal struggle that bubbles over and impacts everyone around you. And so when I figured out a little bit later, when I took psychology courses in undergrad, I took this abnormal psychology course, and I'm reading the textbook about major depression, and I'm reading the textbook about post-traumatic stress disorder. And I was like, oh, that's what I have. That's what that is. My goodness. Like, it has a name. Other people experience this, but not everyone experiences this. So this is so refreshing, but also shocking. Mm-hmm. And, with these illnesses as well, type 1 diabetes is a chronic illness for sure. Once you get it, you're like, yep, you're going to have to deal with this for the rest of your life. With mental illnesses, some of them are, some of them aren't. And you don't know until you move forward in time whether or not you're going to have a recurring disease, or if you're going to be able to get some treatment and work through it and never have problems again. There's a lot more unknown about the mental illnesses that, diabetes many years ago, we didn't know. Cancer many years ago, we didn't know. They were in the same highly stigmatized, bad outcomes, dire state that I want. And I think that mental illness is now moving in that direction too. The more we know about it, the more hope and understanding and options we can give people. And that's what I've been passionate about doing, both from a research perspective and now an advocate and leading this nonprofit effort as well.
That is great. That is great. I never heard mental health. I shouldn't say never. Very seldom did I hear mental health when my career started. It was all mental illness. Mm-hmm. Well, it starts with mental health. And we want to keep people at mental health. But when it's never discussed, it's taboo. It was not, you didn't dare go there. And then when I got into that field, we wanted people to call us counselors or therapists or specialists, because if you talked about mental health, everybody in the room left you. It was just a time. It was just a day for that. And now, I don't know if I like this or not, but it's popular. Mm-hmm. It's vogue. Mm-hmm. There's no taboo. Since the pandemic, I could have 3 full-time practices. I have more people that wants to come than I can possibly see them, because I'm trying to dadgummit get these podcasts and things online. But I literally could have 3 practices. I mean, everybody, and it's okay. Am I happy about that, or am I complaining? I'm happy about that because there's this mental health aspect that is realized. Mm-hmm. And I'm so thankful for that, because someone who is traumatized, or someone who is self-inflicting, or someone who is hiding away inside, it's not just a trait. There's skill that we can learn. There's growth that we can happen. And when it's comorbidity, and of course, diabetes and mental health is my passion, I don't think you can have any one of the others without a mental health component that you need to be addressing. But I don't also think if you've got very much mental health issues that you're addressing, it will impact your immune system. It will impact every other area of your life. So how can we separate them?
Yeah, we shouldn't and we can't. No. Absolutely. Both diabetes and mental illnesses of all sorts are both biologically driven and environmentally impacted diseases. They both interact in that same way. So another chronic illness that I grew up with that's not stigmatized is asthma. So I had this biologically driven physiological response in response to harmless substances such as dander, pollen, trees and things from grass and stuff. Like I would know it's not harmful to others, but it was extremely harmful to me. And there were medicines that I needed to take in order to try to control that. But there were also behaviors I needed to engage in. I needed to not pick up the guinea pig because I was horrifically allergic to them. If someone had a cat, I couldn't sleep in the same room that they spent most of their time in. There were decisions that I had to make. I had to learn that I couldn't eat peanut butter. So I had to be able to communicate with others around me to let me know if they were going to bring peanut snacks or peanut butter cups or
and you
are those sugar cookies or peanut butter cookies? Please let me know so I don't put it in my mouth.
And you also had to know there were choices that you had to make as it related to anger, because you couldn't, or because somebody brought it. You had to deal with the emotions of, I shouldn't be, the victim. I shouldn't be having this problem with a guinea pig. Susie down the street can lift it. So bless God, nobody's going to tell me I can't. I mean, you still had all those emotions as well.
Yep,
to deal with that wasn't labeled, and nor should they be, as a mental illness, but it also has to do with checking your mental health. And so it's just layer after layer. You said that so good early on. I have this tendency, I can go deep quick, and it's not because this hair is really blonde. I promise you I pay good money for it, but I can go deep quick because there are layers after layer after layer of every piece of this. And we live in a time when we can not just talk about it. We don't have to even send an email. We can just flip this computer around, put a book under it, and sit and talk across the country about it. Isn't that a great time? And
oh, it's spectacular. It's spectacular. And, you know, just to kind of speak about what's changed so fast, like back when I was a graduate student, so I went to graduate school at UC Berkeley in molecular and cell biology, because as I was training as an undergrad in psychology, I came to the conclusion we really don't know that much about the underlying biology of these mental illnesses. And so that was something that prompted me to go study at molecular levels, biological levels, what's going on in the world, what do we know about the immune system, like you said, and how does that relate to the brain and behavior? And so that's what I worked on for my graduate work. And at the same time, someone in my department that year, in fact, 4 someones, all died by suicide in 2013. And they completely different reasons. One was a faculty member, one was a postdoctoral fellow, one was my friend and colleague, a graduate student, and one was an undergrad. All completely unrelated, all in the same department, all in the same year. And very few people knew about all of them. And myself and a number of other graduate students, my friends, my colleagues, got together and tried to come up with something that would help ourselves and each other moving forward. So we formed a group very specifically in the wake of the loss of our friend, which, you know, you talk about diabetes having ripple effects. Losing someone to suicide and depression is catastrophic to those who are surviving that. That is very rough. And so we tried to get together to form some kind of a group that could, in an ongoing and preventative manner, destigmatize things. And yet, in 2013, we created essentially a mental health or a mental health focused group.
That's the Dragonfly.
We didn't include the name mental health in it at all. It was too stigmatized. We knew people wouldn't show up. So we called it the Grad Student Network.
In 2013.
It was too stigmatizing.
Can you imagine in 1974 and 5?
No, because what I've found now since engaging in, that was really my first foray into academic mental health advocacy, was as a grad student at Berkeley. And since then, I've had the opportunity to talk to hundreds, if not thousands, of students, faculty, postdocs at all levels, including emeritus faculty, Nobel laureates, and people who have been around for a long, long time. And they have, across the board, if they're, you know, someone who's late career, they didn't even have permission to talk about these things, let alone process their feelings or seek support for themselves. It is heartbreaking. Like I'm just covered in goosebumps of sadness for all the people that have experienced these same things themselves or loss, and not been able to even have the conversations. It was not allowed.
That is so, and I'm not surprised at the story. I'm surprised at the year.
You thought it was better at that point already?
I thought by then, you know, I tell you, as much as a pandemic has been not what the world wanted, it has opened up some things that will never close. So,
absolutely.
You know, I'm always looking for something on the flip side. Everything has an option. Everything has another side. Everything has a choice. And the other side of a pandemic is where I couldn't even counsel online very long before. And when we first started the pandemic, they didn't know how long they were going to let the past be. Well, they're never going to shut us down. They can't.
No.
You know what I'm saying? Yeah. So much for, we can't get the facial contact. We can't get the empathy emotions. We can't understand what's going on because we're looking at each other and we really can't. You know what I'm saying? So all of those things that seem ridiculous today, even 5 years ago, 10 years ago. So I shouldn't be surprised, but somehow for an old girl, 2012, 2013, 2010 seems like yesterday. seems like yesterday. So it just still saddens me.
Yeah.
It saddens me. And yet I have a choice to make sure I see the side of growth. And here we sit today.
Mm-hmm.
Here we sit. I don't want to get off here and not get to what you're doing and how people can get to you. I'm only snooty about a few things.
Uh-huh.
And one is that information is so out there and opinions are wonderful, but they're like noses. Everybody has one. They don't always have to be correct. And not that I think everything is right and wrong, but if I'm snooty about anything, if I'm going to offer a perspective outside of mine, I want it to be someone who has studied and knows the value of more than one perspective. And then we all add to that body of knowledge, and then we help a community. In my case, it's patients with diabetes that deal with anxiety and stress. And I'd be happy sometimes to know your take on what I'm doing in that space. But when it's mental health and life or death, it can be that for diabetes patients. It's certainly that for suicidal ideation, way more than we would like to admit. And then we feel lost and failed. We feel like we failed in the process. And so there's all of those pieces to work with. And I'm so glad you're doing that in the academic world and on this, taking this challenge to come on and just speak to patients that may not have the opportunity to hear your perspective in some other. She's not going to come. Somebody in my little world might not be coming to California and could not get into the schools that you're speaking to and the research departments, but can sit here today and hear your perspective. So tell us a little bit as we close, tell us a little bit about Dragonfly and what you're doing for this world.
Sure.
And how people can get in touch with you if we need you.
Yeah, absolutely. And so Dragonfly Mental Health is a new nonprofit. We were only founded in April 2020, so really at the beginning of the pandemic. And we are dedicated to cultivating excellent mental health among academics worldwide. And we very carefully chose those words with which to essentially set our mission, because even though one of the motivating factors is friends that I've lost to suicide and mental illness, and it's not just the avoidance of these worst case scenarios. We think that both academics and everyone worldwide should have access to more evidence-based approaches and community that is competent and compassionate and passionate about taking care of one another, and bring everyone not to just avoid illness, prevent it, but to those who develop chronic illnesses because of biological predisposition, they can also have mentally healthy lives with the right treatment and interventions and community support. And so that's what we're focusing on. And what we're focusing on first is academia, because that's where I've had the most loss and where I know the most about the culture within academia. And in addition, and a lot of people and a lot of folks that are consider themselves patients, not academics or researchers themselves or doctors, may have this preconceived notion that, well, doctors and people with PhDs, they've got all their stuff together. They must all be mentally fine, right? The opposite is actually true. The rates of depression and anxiety and other serious mental illnesses like OCD and bipolar disorder and people on the autism spectrum, the rates are much, much higher among academics. So 6 to 8 times higher rates of depression and anxiety among graduate students than the general population. And so this is another reason that I focus on academics specifically, because there is such a high need in this group. They're particularly at at risk. And so that's a little bit about who we are. And what we do is we're currently 260 volunteers strong. We pride ourselves in being by academics for academics. But if one of your listeners is interested in learning more or getting involved as an academic adjacent individual, we'd be more than happy to welcome you into the fold too. And we conduct research because that's kind of our bread and butter, but we also build community. So we have something that is available for all academics. This one is kind of exclusively for academics, people who are in postgraduate education or residents or faculty themselves, but for folks within that sphere to come together and provide each other peer support in a non-judgmental space. And then we also, and our most critical thing that we've been doing, an impactful thing, has been our on-campus programs. So we deliver evidence-based information, education, skills workshops, and anti-stigma campaigns directly to campuses, universities, and scientific and academic associations. And in just a year and a half, we've delivered over 100 programs to more than 10,000 academics in 11, now 12 countries as of yesterday.
Well, if it's true that doctors, the Latin for that is teacher. And so if it's true that doctors teach, then you're in your element and in all of ours. Because if everybody in the academic world were to not just learn for themselves and how to pass it on, but if they can receive help and healing based on what information we're passing to the world, then we're going to make a bigger difference to those that may be listening to us today. My hope is there's somebody that's in college, there's somebody in med school, there's somebody that's not quite finished with climbing. I hate to use that word, but you know what I mean. And they're becoming maybe is a better word, that it may interest what you're doing, and who knows what they might start in their own part of the world or what might lead them on. So these kind of conversations are never wasted. But I so appreciate you coming on and talking to me. I'm telling you, when you talk about mental health as it relates, and I know for you, your heart is more in the suicidal ideation and follow through because of your own losses. And mine in type 1, because of my own experience and all those that I've watched and dealt with in a Southern culture who was not taught to this day. It's hard to eat well in my cultural setting. But when we have such varied modalities, and yet we have such like hearts, and mental health can be the middle of all of that, we're in a good day. I wish I could high five you, because that doesn't just work in school. That doesn't just work in research. That doesn't just work for the patient. That is life and society and cultural changing happening within while we even speak. So thank you so much.
My pleasure. And thank you for being part of the change too. This is just, that no one can do this alone. We all have to do it together.
I'm still can't get over 2013.
Yeah, we've come a long way, but people can reach out to us or check out more from us or see any of our videos. We have a lot of material online on our YouTube channel. We're dedicated to open access. So anything we've created, we make sure that it's available to the public, but people can find that at dragonflymentalhealth.org and get in touch with us through that as well.
That I'm so glad you reminded me to get that out there, because yes, we need somewhere to go, and Dragonfly Mental Health should be easy to remember, right?
Yeah.
You guys were marketing geniuses with that.
Oh, thanks.
Thank you so much. And you have a lovely, lovely day.
You too. So great to chat with
Bye-bye.
you.